So what's the most common dental habit or treatment that you see every day that's actually making people worse instead of better and they don't even realize it?
Oh my gosh, Steve. It's actually, I don't think anyone gonna guess this answer, but it's actually your dental cleaning.
Really? So just like you think you're going in to get a good, healthy dental cleaning and that's could be bad?
It is so, misguided when people thinking, I'm gonna be proactive. I'm gonna go get a dental checkup. I'm gonna get a cleaning. But when you go in, you don't even know what you're cleaning off. There's no saliva test being done. When you go to a doctor, do you think they're gonna do a exam without blood work? And they're gonna just look at you, Steve, and say, "You look great, Steve. I think your cholesterol and everything looks good." They have to do a blood work. So when you come in to see a dentist, if they don't do a saliva check, they don't know what they're treating. They are just guessing, right? And so they go look at your gum and they say, "Oh, everything looks fine. See you back in 6 months." And then another 6 months, another year, and then you start seeing symptoms like autoimmune, Alzheimer, things that you be like, "Where's that coming from?" It's all showing in your mouth all this time. And you come in religiously every 6 months. Some of you come in every 3 months. And so proud of like, I don't miss my dental appointment. I go to see my dentist more than my physician, but you still end up with the chronic diseases. So the dental cleaning is your opportunity to understand what your body is trying to tell you through your saliva, through your gums, to your teeth. And when you understand what you're treating, the treatment approach is so different. It's no longer just like polishing your teeth and make you feel good about that visit, but actually said, I'm targeting the biofilm that you swallow every 30 seconds, only about 2,000 times a day. You swallow that bacteria. Like in our office, we have a phase contrast microscope, Steve. So we actually take a sample live under your gum, put it on this microscope, and you see bugs swimming, parasites swimming. I mean, thing that people are like, that's in my mouth. I'm like, yeah, so don't kiss your spouse when you get home, don't spread this around, because we're actually treating what we're seeing on the screen, what we're seeing on the saliva test report, and we send that report to the medical doctor, and the medical doctor will say, oh my gosh, I need to start treating this patient because we see spirochete on here. And spirochete is like screwing into your brain and start creating those plaque. And people don't know that, years and decades later, they start having symptoms of cognitive decline. And so the dental cleaning that you think, I'm doing myself a favor, if you don't get a good and correct diagnosis on the cleaning, on the saliva, on that check, you are actually just mirroring, like spreading things all around and then just kind of cover and patching it up.
Uh-oh. Okay. So if you're listening, you're like, oh my gosh, I've been thinking I've been doing this right and I'm doing it all wrong. So let's kind of rewind just a second. Because as well as me, your mouth, that's that window. It's, you hear it, it's your window to your whole digestive system, which is actually the only thing that keeps you from the outside world. It's the first stopping place. I would say it's like the first line of defenders, right, in an army. That's your mouth. And so that's kind of what I'm hearing from you. So how does a wellness dentist practice different than a traditional dentist? I think we're going to get into this. You've already kind of mentioned one thing, but overall, what is that? How does that practice look different?
Yes, we have 3 key differences. Number one, patience is the hero of the journey. We want the patients to be well educated and also take the ownership, because we see in a lot of patients that I'll do what you tell me to do. No, I'll do what you want us to do when you understand this relationship. It's not I'll do what my doctor say. Oh, is my doctor in charge of my medication? Oh, I don't know what I'm taking. It's like the ownership had to be back with the patient, because that's where wellness starts with you as a patient. And so very first visit, we established that role. We are your guy. We're guiding you through. You're going to have many other people on your team, your medical doctor, your chiropractor, your pharmacist, like on your team. But you had to be the hero and you had to be willing to do the work. We cannot want you to be better than you want that for yourself. And so that's why wellness dentistry start with ownership. And we see a lot of transformation in our patients because they take that ownership seriously. And 2 is like medical dental collaboration. You cannot do dentistry by just look at the mouth and ignore everything else and not make the connection to the rest of the body. So every patient that we see in our practice have to have a medical professional. It doesn't have to be an MD. It could be an NP. It could be a DL. It could be a DC. Anyone that we can talk to and give them update about what we're seeing in their mouth and what else is showing up in the body. So medical dental collaborations. And lastly, the procedure that we're doing, the material what you're using had to be compatible with you. It had to be make you healthier and not sicker. And I think most dentists not taught how to check for biocompatibility and thinking, oh, this material work for everybody. It should work for whoever walk in my door. So when they buy supply, they don't think about biocompatibility. They think about, I like this material, I like this color, I like this price, versus like, is this work for this person? So personalization is the last piece.
So dentistry, traditionally wise, is a lot like traditional medicine. It's the one size fits all approach, where dentistry is just like an individual personalized medicine approach, that it has to be one-on-one because we're all very unique in what we do and our reactions. So that's a really pretty cool call out. So you sit and look at mouths all day long, and maybe people's like, okay, there's some gums, there's some teeth, there's some saliva, there's some spit in there. But I'll guarantee you, I bet you can tell me what type of health issues or medical conditions can you look in somebody's mouth and almost predict they have them. Does that make sense?
Oh, yes. You know what? The interesting things we noticed, that patient coming to see us, a lot of that are women because they listen to their body. They start noticing the change. And so just say walking through a journey with a patient that's been in our chair in their teen, right? They start hitting puberty. We start seeing hormone changes. And then we start seeing inflammation in the gum, sometimes isolated, sometimes kind of generalized. And then every time that kind of closes the cycle, they bleed more. Of course, right? Your body getting ready for that. So even your gums start puffier and then bleeding easier. And so if people don't understand that, they think, oh, what's going on? Do I have gingivitis? I mean, what's going on with me? Because the mouth is actually a window to the rest of the body, gateway to the gut, but also the window, because it's so easy to access to see the teeth, the bone, gums are kind of what lining the gut. And then when they get to the age where they become, a mom, like getting pregnant, God, pregnancy is so dramatic to the patient, right? To the body. You go through like a roller coaster of things, and then sleep issues, and, could not breathe, and craving for things that, is not good for your teeth, right? You're going through all that. And then you also can see the mouth changes in there. Also, we see patient gums that puffier, their mouth getting, easier to get irritated. And then fast forward, when they get into the perimenopause and menopause, you start seeing dry mouth. And people thought, oh, it's just a part of aging. No, it's not. So your mouth going through all of this, stages. And every stages, people will say, I never have cavities. And boom, I have like 10 cavities in the last, 2-3 years. And it's almost like they all got surprised. They're like, nobody prepared me for this. Just like menopause, nobody prepared these women for this information, and they feel like they get hit by the train, and suddenly everything break down, right? The sleep messed up, their teeth have cavities, and now they feel like nothing's really going on well. So we can see so much from the mouth, especially when we make that connections and really talk to them at every stage, every season of life.
Yeah, so you actually see, and that's something I know you and I were talking when we first jumped on, was you can actually see changes in the mouth directly related to hormone changes. Do you see that not only in women, do you see that in men too, like with low testosterone, or is that something you can see?
Yes. And sometimes people don't know where to look, right? Just one of our questions on every single visit, no matter you see me 3 months ago or you never see me before, when the last time you get your blood work checked? You'll be shocked. People are like, oh, 7 years ago. Like, oh, great. Oh, I'm doing great. And then when they're admitting to like all these changes in the body, like, oh, I think it's time to get that checkup again. So yes, men, women, we all see the same thing. It changes in the mouth, and it have severe consequences. Irreversible.
So what you just said, so would you say the blood work to a doctor's visit would be the equivalent of a saliva check to a dental checkup? Did you call those similar, Rhett?
Yes.
That was kind of what I heard.
No saliva check, we're just guessing.
Okay.
Yes.
Very cool. So what when you look at saliva, you mentioned pathogens. What are the things show up in saliva that gives you an indication that either the health's good or the health is bad? What are you looking for?
So we're using the phase contrast microscope as a screening tool, just like the blood pressure cup, right? If someone elevated, you're like, okay, something's going on here. We need to investigate further. So our phase contrast microscope is our screening tool on site, visible, someone can see. So there's two things we look for. Number one is what type of pathogen consider high risk that's showing up on that slide. So spirochete, gliding, like gliding rod, and amoeba, trichomonas. If it show up on your slide, white blood cell, because that's a chronic size of chronic infections going on. If we see that on your slide, we know your body fighting something. However, activity of these bugs is also very important. If they spinning like crazy and they crowded and they communicating with each other, that means they've not only been there for a long time, they're taking over your immune system. Your immune systems are like, I'm tired, I'm exhausted. It's been like going on every day and I'm fighting every day. I'm going to war every day. So the slide actually giving us a really good screening of, number one, what in the mouth? Number two, what is your immune system doing? Is it being overwhelmed or is it actually taking really good control and fighting and winning? So that slide for me is, non-negotiable for every single patient visit.
No, that's really awesome. So, all right, I've got to talk mouth microbiome, okay? Because I know I know a lot about gut microbiome only because I've worked with thousands of women. I'm very familiar with vaginal microbiome. I don't know anything about the mouth microbiome. So tell me a little bit about how maybe the mouth microbiome is a little different than the gut microbiome, but then what makes them similar? Tell me like maybe certain strains that you like to see. I mean, I don't know anything, so I'd love to hear your take.
Yeah. So for the microbiome in the mouth, there's things that we're looking for, consider like the high risk pathogens and moderate risk and then a low risk. And they all tie to different systemic risk association, even low birth weight. Women would be like, oh, I have complication with pregnancy. Haven't anyone done a saliva test on you during your pregnancy? No. Well, we're missing a lot of these opportunities to help these women to improving their health and their pregnancy and their baby, right? So pathogen like TD, TF, PG, AA, I mean, it's so dangerous and people seeing it that it's in the mouth on the regular basis. So what happens, we notice when the good microbiome is being pushed out or being overwhelmed by the bad microbiome, that's also affecting bad breath, affecting your sleep quality, because this is only 3 inches from the brain and it's under the nose. If you don't have nitric oxide through your nasal breathing, your mouth will have, overgrowth of these bad bacteria and this microbiome, and you're losing the good microbiome, and your body doesn't really know how to reestablish that good microbiome. Even though you're eating organic, you're drinking enough water, you try really well doing your sleep and cut down your screen, but you mouth breathing. Now you destroy your microbiome.
Gotcha. So I know we look at diversity for the gut, but in the mouth, are there certain strains of bacteria? Like I've got a toothpaste from one of the wellness people that's got a couple strains of some lactobacillus in there.
Yes.
Are there certain strains that we want to have in our mouth that have been shown to lead to better health versus ones that don't? Does that make any sense at all?
It does. The interesting about the mouth, since it's such a dynamic space where you're talking, you're swallowing, you're drinking, you're eating, you're chewing, it is a really dynamic place to completely keep it clean. That's why you have saliva. Saliva is your natural defense for your body. I remember growing up, if I have a bug bite, my mom was like, putting my saliva on it. I'm like, ew, gross. But actually it is really working. It's helping you to protect against the outside world. So the mouth is more about your body know what to do. We don't want to have to do overwork, except the fact that we need to protect, lower the bad bacteria. So your natural immune system know exactly what to do and also give it the good environment. So for example, I would say number one reason people have cavity is not because of sugar, because our patients usually know better, but it's mouth breathing. Mouth breathing causing more cavities than anything. And so when people was like, oh, I want to, have a good microbiome, are you breathing through your nose? If you're not, are you tipping your mouth at night? It's not what we add, but actually we remove or correct is help with the microbiome to reestablish. And in patients that we just correct a few things, the microbiome start get back to help on its own without taking extra supplement, without doing extra things. Because, who doesn't have a 30-minute, evening routine already? We don't need to chewing this tablet for 10 minutes and doing this oil pulling for 20 minutes. When you're going to sleep? So we actually like to simplify the process, removing the bad ingredient, bad influence, right? Toxicity, and then let your own body doing the work. Like get out of the way. Get out of the way, simplify things, and just go back to the basic.
Okay, man, you're my brain. I've got like 7 questions just off of just what you said. So I've had Dr. Sachin Patel on here, and he talked about mouth taping and mouth breathing and all. Do you recommend mouth taping at night to encourage? Wait, what do you, I just curiosity wise, is that something you recommend? Because he was talking even like, and you, I'm sure in your practice, this whole airway thing and sleep apnea and all that stuff, that all ties in because even something like that can change the structure of your mouth and your face and how you breathe. And like, give me your thoughts on that. I'd love to hear your thoughts.
Yeah, because I love the fact that people just kind of listen to a 10-second clip and say, oh my God, everybody had to tape them out. Everybody had to. Well, obviously, if you cannot breathe through your nose, don't tape your mouth, right? It's a common sense, but it's not common practice. Right? People just tape it like, I can't breathe. Well, if you have congestion, if you cannot breathe through your nose, you gotta see an ENT that understand the airway and connection. But you only tape your mouth if you notice, I can't breathe through my nose. But I don't because my mouth been compensating for so long. So yes, the short answer for that is you have to seal your mouth when you're not talking, when you're not eating. Your mouth have to close. Your tongue had to go up to the roof of your mouth and not just like park down here in the lower. And that's also mean that your tongue doesn't go home. That means you also possibly have a tongue tie, possibly have an MTHFR,
right?
Possibly have a narrow mouth, possibly have an airway issue. So a lot of possibility, but that's the reason why you work with a provider to understand personalization, doing all the check to make sure that do I need to, because a lot of time people hear expansion, CPAP machine, like all this thing. And they're like, do I need that? Well, I don't know. Let's go ahead and do a personal evaluation before we jump into conclusion. And again, we like to do less, not more, because I know everyone can do less. But if you keep adding more, people actually cannot comply. And therefore, they don't see the transformation they're looking for.
You taught me a new word combination, mouth-body connection, which makes perfectly good sense. And I think about my journey through functional medicine and learning things and wellness. And that's how people with cardiovascular disease, they can look in their plaques and actually find bacteria and fragments from mouth bacteria that have gotten basically from the mouth. You've swallowed, leaky gut, they get in, they trigger immune type stuff. So you kind of mentioned like that aspect of stuff, but then you also mentioned like nitric oxide production, which is a major area. Tell me a little bit how this wellness industry ties into like cardiovascular health. Like, I think that's huge.
My goodness. I mean, study after study, which is coming from the medical side and the dental side, saying that more than 95% of cardiovascular patients, when they study the plaque, the bacteria come from the mouth. I have a patient sitting in my chair yesterday, was sent here by his cardiologist because they found the bacteria in his plaque. He survived the heart attack. And it coming from the mouth. And guess what? Nobody ever looked at his mouth and screening for inspection. He's like, I have no pain. I see the same dentist for 30 years. But my cardiologist sent me to you. So what is the role of mouth and oral health in cardiovascular health? Well, everything tied to inflammation. And if you don't know where the inflammation comes from, how do you can prevent it? Especially, people don't think about it this way. Everything from the neck up is like an upstream area. Anything from the neck down is a downstream area. So if you have infection in your jaw, even though it doesn't hurt, it's been draining downstream. It'd be draining to your cardiovascular system, it's draining to your hormone, draining to your gut. So you can eat clean and do everything for years. You try to fix your gut. You always feel like you're hitting the wall. It's because you haven't looked at the upstream. Have you looked at your sinuses? Do you have any blockage there? The mouth, do you have any toxicity? You have any hidden infection? For that patient I told you about when he coming from the cardiologist's office, he had a hidden infection in his front tooth. He had a root canal done about 30 years ago after a sport accident. No pain, nothing. He actually have a crown on the tooth, but no one ever done a 3D CBCT on him and found a huge lesion on that infection sitting there. No pain, but it's been draining down, and that's where the source of infection coming from. So again, if you have infection, if you have inflammation, that's become a burden to your cardiovascular system. And regardless of where it come from, it's going to create a cardiovascular event. So the mouth, most of the time people don't feel the pain, right? If they feel pain, they will show up in the dental office, but most of the time they don't. So we find infection and inflammation in the jaw and in the mouth where people are like, but I had that procedure done 30 years ago. What do you mean that it's been sitting there all this time? Well, that's the reason why you had to constantly get some checkup, and technology help with that too.
So it sounds like your mouth can be a true predictor of health, and you, with your training, can spot things way in advance. So I'm going to throw you a softball on this one. So we've talked about mouth and nitric oxide and how important it is, and then ultimately cardiovascular health. Mouthwashes. Like, I know this one's kind of funny. Like, tell me what goes wrong when somebody does a mouthwash so that we can just like get that one over with.
Pretty much wipe out everything, and mouthwash kill the ability for you to also convert nitrate to nitric oxide, and it's wipe out your good guys and your bad guy. And all the mouthwash in the market, most of them have alcohol in it. So it's just like you are disinfect to the point your body doesn't know where to start, and you just wipe out good guy as well, some of the bad guy. And then people thinking like, oh, if I'm just mouthwash my way instead of flossings or, taking care of my health, like stay hydrated, mouth taping, water picking and all that. And they just think mouthwash is the answer for it. You actually hurting your system way more. And the mouth just begin at the gut. You do have that kind of go down to your gut where, you're spitting out, but it's in your saliva, and you swallow that saliva every 30 seconds. And so my point is mouthwash is not something you use every day. We only prescribe mouthwash for patients that we see need. And then maximum the amount of time is 30 days, and then recheck again. Because if you want the best mouthwash, warm salt water. Go back to what works for thousands of years, right? Warm salt water, but it has to be clean water. We prefer distilled water or spring water, not tap water, especially you live in Houston. Don't rinse your mouth with tap water, because you know what? We've seen bacteria on the slide when someone's switching from tap water rinsing to clean water rinsing or filter water rinsing. The bacteria are just like completely different.
That's amazing. That's crazy.
You have to pay attention to the water that you're drinking, brushing, showering with. And so the slide really giving us, the saliva test giving us a lot of information that people thinking, oh, I'm doing so good. But you're rinsing with the tap water, then you need to rethink that twice.
So you mentioned the mouth's very predictive of health in advance, even though there's no pain. So when you look at somebody's mouth, what are the things that tell you of warning signs that there's something else going on? You kind of mentioned saliva a little bit. You can actually physically see that. But what are the other indications that you look at in a mouth that indicate, we got a problem here? If you don't already see a doctor, you got to go see one. What are those things?
Yes. So interesting, people thinking dentists would look at teeth. We also look at gums and tongue. So for example, the tongue, when we look at the tongue, if it has white coating on it, that size of candida, yeast overgrowth. And so a patient was like, yeah, I'm craving for donuts and cupcake. Well, you definitely have a problem there. And then we also have people that have scallop, like a little shape of the teeth along the side of the tongue. That means that either they clenching, grinding, or fighting for air at night, with the mouth just too small for their tongue. And so obviously they will have some obstructions or airway issues when they lay down on their back or sleeping. So again, that's going to sign. If we see some redness and raw on the tongue, could be a low iron or B12 deficiency. So we can definitely tell them to go see their doctor. Hey, when the last time you get your blood work? And sometimes the blood work is not comprehensive enough to find this information, right? And then if we start seeing that they having cavity in area that not usually have cavity, we also asking every patient for vitamin D level. Because you can't have a good immune system or sleep or digestive system or hormone system without the proper vitamin D level, especially for teeth. We actually don't do surgery on any patient that the vitamin D is below 50. It's so crucial. So there's a lot of things that we look in the mouth. We also, people said, oh yeah, my teeth changes over the year, but it doesn't hurt. Well, your teeth are bones. If your bone changing shape, getting shorter, breaking down, are you want to investigate, or you just wait until it hurt? And so there's a lot of things going on in the mouth that's showing years and decades before things got worse. And people just don't understand and don't listen or not investigating enough to make that connection to the rest of the body. We've seen a lot of people with GERD, acid reflux in the mouth. Teeth are shiny and they smooth. That's not a good sign. That means acid been coming up, right, on your teeth at night. Sometimes we see on one side of the mouth and not the other. That means they're laying on one side, the acid go up on one side. So it's very interesting. We see so much in the mouth. And when we're asking, We need to talk to your doctor. You need to bring this to your doctor. And people are like, I don't have a doctor to understand that. Or they just discount or laugh it off. And the thing is, you have to find the right doctor on the team that willing to listen instead of give you prescriptions for Paralizet, for GERD,
Gotcha. Yeah. You mentioned, I watched one of your social media reels and you've said something, you look at a tooth extraction as a surgery. And you made that comment, vitamin D was one of those things. There's 3 things you check that you mentioned that you do, because you look at an extraction just like a surgery, because as well as me, there's stress with it, there's healing with it. What are those 3? I don't really know any dentist that does that. So what are those 3 things you check before you'll even do like a tooth extraction?
Yes. So number 1, obviously vitamin D. Cannot do surgery if it's below 50. You're not going to build bone with the deficiency of vitamin D, and therefore your bone quality is not going to be good. Number 2, A1C. My goodness, people walking around with inflammations and not having ability to heal when their A1Cs are like 6.5. I know I have a patient 7.1, and he's like, oh yeah, I feel great. I'm like, no, let's just address this before we are doing bone surgery on you, right? And the crazy thing is, we never been taught looking at this as a dentist. We would do massive surgery, taking multiple teeth out on patients and not knowing the D level, the A1C, and the high sensitive CRP. In some patients, we've been looking for homocysteine, the MPO. We talk to their cardiologist because they're already working with one. And it's amazing the before and after blood test, after the infection being addressed. And these medical doctor was like, oh my God, the dentist play a big part in lower the inflammation, the whole body inflammation. I just got an email back from the patient and said, after you got that out, now my numbers improved significantly. Nothing else changed, just that one surgery.
You're right. And that mouth can be that driver of inflammation. Now, like you, even working with a wellness practitioner, they can have done everything, fix hormones, stress, gut. And they're like, where's this inflammation still coming from? And it's the mouth. So that's really pretty awesome. And looking, I don't know, you just keep saying things and I'm like, oh my gosh, I got to ask her that. I got to ask her this. So it's like, you get me all excited on this. Cause like I'm learning a lot of stuff. I'm a pharmacist, right? So are there medications? Like I know in pharmacy school, I was taught phenytoin caused gingival hyperplasia. Like I remember that from pharmacy school. Nobody takes that for seizures no more. But is there any common drugs? I don't even know what they would be. You tell me, are there any common drugs that you see that people are on that does affect mouth health that people commonly take?
Well, teenagers are taking a lot of, antibiotic for the acne, right? And they don't understand that these, antibiotic actually make their teeth yellower. And so they would come in and like, I want my teeth to get whitening. I'm like, okay, what medication you on? And they said, oh yeah, Accutane for acne. I'm like, do you know the side effect is actually make your teeth yellower? So we can whiten all they want, but because the yellowing and the discoloration coming from within, from inside, is intrinsic stain, not extrinsic, like coffee or tea, And so when people understand like, oh, okay, I need to talk to my dermatologist about this to see is any other option. Maybe lifestyle is a better option than taking, Accutane for your acne, and stop eating the fried food and start, focus on the gut health. And so those are the things we see on that. Patient also on, hypertension's medication, tons of dry mouth. What common allergy medication is over the counter, Claritin D, right? All of this, an allergy shot. And people are like, oh yeah, I have terrible allergy, but they never taught how to help with that. Versus they just, go monthly shot or they're taking their prescription. And then the dry mouth was massive. They would have like a ship in how many cavities they have just in a short period of time. I would say 3 to 6 months, exploded with cavity that they didn't have before. And they were like, what I did wrong? I do everything the same. I'm eating the same, cleaning my teeth the same, but they don't understand the systemic medication complication that causing that and how to cope with it. If you had to be on it, what are you doing? There's a lot of ways. Sipping on water every hour instead of just drinking 16 hours for like 4 hours and not drinking anything. And so a lot of communication, that's why dentists have to understand the medication the patient's on and then understand how to help them to cope through that season of life that they need that support. And of course, work with someone like you who helping them not just stay on the medication, but getting off the medication because they know how to take care of themselves better. And so it's a team sport. That's why every single NFL team have a dentist on their team, right? If you want to be a winning team, you have to take care of your whole body. And you don't have a dentist on your team not complete.
Right. So you just hit on something that I get asked about all the time. And you already kind of gave one tip, and especially I see this with women as they get older, it's this dry mouth. And it is so common. We think, what can we do? What can you compound? What supplements can you take? I mean, I always push like omega-3s, optimizing hormones. Those are like no-brainers. We know that. But for you on a wellness dentist side, what are your approaches to dry mouth? Because one, tell me how a dry mouth affects your overall mouth. But then like, what are some things that maybe you can kind of help curtail that?
Dry mouth, number one, is very miserable. People have a hard time to talk. They actually can eat certain food because it's uncomfortable, but it wipes out your microbiome. It's causing bad breath. So you're like so, annoying and self-conscious about that. And of course, rampant root decay. It's not just any decay or any cavity. It's cavity that happen in the root area. So it's really hard to access to. And the gums are raw and it's really, really hard to function. I've seen people that actually, become depression. Like they have a depression because they can't, taking care of their dry mouth. And now the quality of life is reduced significantly. So for those patients, the number one we're telling them is removing a lot of things that they're doing at home that causing more irritation, like toothpaste. Like don't use toothpaste that actually adding or aggregated to these dry mouth symptoms. A lot of toothpaste has so many additive or chemical like silica, SLS, things that actually the foaming agent actually make it worse, like get your gum, your gingival tissue sloughing off. So we're telling them, hey, go back to the basic. You can make your own toothpaste with 2 ingredients, organic cold pressed coconut oil and baking soda, and brush with that. That will help you eliminate all that chemical and sensitive things that making your dry mouth worse. And then of course, sipping on water throughout the day, but it had to be clean water. Cannot be just any water. Cannot, you don't want to irritate it more. Add some electrolyte on it to help to get that water. But we're also having a lot of things that we can give them to help with, lubricate. Not just glycerin that helps just to kind of make it, smooth, but antioxidant gel. There's a pair of science, actually a fellow Texans that invented it. And my mom, when she go through cancer treatment, her dry mouth was really severe. And that gels really help to lubricate it. And then also reduce everything. Just like I said, remove the existing toothpaste, no mouthwash. Okay. You can actually doing oil pulling to help, really gentle to the tissues. And then of course, keep your lips sealed so you don't get more dry mouth from the mouth breathing. And then address the root cause symptoms in the meantime. A lot of patients, when we see they have dry mouth, they have things in the mouth make it worse, like plastic fillings or mercury fillings and crown material that making the gum more irritated. So we want to remove the toxicity to improving the conditions in the mouth. We notice people that having a lot of that issues when we're removing the irritant in the mouth, they reduce significantly. So it's like a teamwork. You got to do the work, but you actually will and feel a lot better when you actually work with the team to understand how to manage that dry mouth symptom. And people that take you seriously instead of just kind of like, oh, go out there and buy some Biotin and you'll be okay. People like that, they actually very miserable living with dry mouth condition. And it's costly because it's hurting their teeth and the ability to function.
Yeah, that's a great call out. I guess I will just say we see that so much. It's so very common. And like you mentioned, there's a lot of medications, like all those non quote unquote super safe, non-sedating and oral antihistamines. Mm-hmm. They still have what's called an anticholinergic effect. You got people who are on some of like different things for sleep. You've got all these that can still cause dry mouth issues. It's just a side effect, but you're right. It's destroying your mouth. And like we talked about, your mouth plays a huge role in your overall health. So I guess the next thing that I would say is if you could redesign someone's bathroom shelf of their oral products, okay?
Yes.
What would that redesign look like? What would you change? What would you change out for people to have the best mouth health and wellness?
Okay, I love this question because no one ever asked me this before, but I can tell you exactly what I have on my bathroom shelf. because I'm a simple girl. I actually noticed that people create so many products, so many steps, and people get really confused. It's hard to commit to, right? And so number one, get a good toothbrush. It can be manual or electric, but your teeth not going to brush itself. You still have to pick up the toothbrush, and the toothbrush either have a timer or you have a timer in your bathroom. Because, we're thinking we brush for a long time. It's like 40 seconds. And we're like, okay, I'm done. I'm busy. I'm tired, right? At night, I'm tired. In the morning, I'll have to get out of the house. So get a timer on your brush. If you have electric toothbrush, it usually have a 2-minute timer. If you have a manual toothbrush, do yourself a favor, have a timer in your bathroom because you need to brush long enough. People just cut up the silver bullet and a cheat code to like, how can I brush, effectively by using stronger toothpaste or mouthwash, right? But no, the brushing is not only remove the biofilm on your teeth, very important at night because you accumulate so much throughout the day, but also very important in the morning because after all night sleep, you have a lot of detox on your teeth. And so you want to brush that up before you eat your breakfast. Otherwise, you just have a lot of bacteria that you enjoy with your breakfast. So you want to do that. But brushing is not only remove the biofilm, it's also massaging and circulating, improve circulation in your gum, blood flow, exercise, cheek stretching. And really all day long, we're talking and smiling and our mouth always go inward. So brushing, moving the cheek, different direction, it is a yoga for your face. So take your time. Think about brushing is like I'm exercising my face versus just like I need to get out of here and really quickly. So for me, do it intentionally, make it simple, but make it count. So brushing, it had to be super soft toothbrush. If I can brush my under eye with your toothbrush, then that brush pass. If it hurt my under eye, then you cannot brush your gum with it. That's the trick. All right. Second thing, floss. People telling me, oh, I don't have to floss. Yes, if you have a perfect chewing pattern that you don't have food stuck between your teeth and you have perfect straight teeth, then maybe flossing is optional. But these days, finding those patients is very rare. Everyone have compensation mode of chewing. They have tongue tie, they have cheek tie, so they don't chew efficiently. So food stuck between the teeth very easily, and they have gap and things like that. So flossing help losing things between your teeth, right? And so you want to loosen it before you brushing. Water pick for me is not only about remove the biofilm between the teeth, but it's also massaging and helping the mouth getting clean. So for me, those are the 3 things that non-negotiable. Anything else, it's just like cherry on top. You can oil pulling once a week, 2 or 3 times a week if you want to. You can do mouthwash if your dentist seeing that your saliva test showing that you have bacteria that are harming you. Toothpaste is for pleasure. It's not really a mandatory requirement item that people think. People go fighting online about this toothpaste is better than that toothpaste. And I said, just pick up your toothbrush and brush with water. Better than not brushing and just picking expensive toothpaste and then brush for 20 seconds. And so toothpaste is do what you like, what flavor you like, but it's not a key ingredient for have healthy mouth. It is the manual. Just like you think about working out, right? People are like, what kind of workout good for me? Well, just move your body. Just burn some calorie, right? And then go to technical. So do the basic first. And the order for me is flossing, water picking, brushing.
Very cool.
And then tongue cleaning, it's free.
All right. No, that's good. I got to go get a timer. Like maybe that's what I need because I'm not going to lie with my hectic life. It's like, how fast can I brush and get out? But like you just told me, it's yoga for my mouth. So I've got to rethink that process. So I love that.
Back to the basic is what wellness is about. Don't stress yourself out. I don't want your routine in the morning at night. It's like stress yourself out and of course your cortisol level go up. Nope. And now you're not doing yourself a favor.
Gotcha. Yeah, we don't want to be stressed out about brushing our teeth, but it is something that we need to be doing. All right, so I'm gonna play some fun rapid fire questions, but I'm not gonna give you much time to answer. But I want you're honest. Okay, fluoride replacement, children, adults. What's your take on that?
Everyone.
Okay, there's still enough data to say you need fluoride.
We don't know how much you've been exposed to, so it's like you try to prescribe the patient something, Steve, and you don't know what they've been taking. So for me, I would just make sure that we get you up because exposed every day, accumulation, compound effect. So I need to know, is you drinking tap water? Is that fluoride any of the sources? Do you need it? All of that testing needs to be, or that question needs to be answered.
Gotcha. Great question. Teeth whitening agents. What's your take on those?
Teeth whitening agent depends on if you have sensitivity or not. And also it's a personal preference. Everyone love a whiter teeth. Do you have to have it? Can you keep up with it? Are you going to stay away from color food when you're whitening it? Because otherwise, why are you doing it? Because the color is going to come right back. So it's a personal preference. And there's a way to do it without harming your teeth and hurting yourself, which is sensitivity to the teeth is crazy. It's like in the nerve and people like can't even smile. They have to take ibuprofen when it's hurting so bad. So just don't harm yourself. Understand your teeth. A lot of people have more enamel than the other, and all about the sensitivity too is a part of the experience.
Very good. 2 fun wellness things I see being pushed for mouth care: hydroxyapatite and xylitol. What are your take on those 2 things?
Again, for me, moderation is key, and personalization. Cannot be a blanket statement. Everybody needs xylitol. Everybody needs hydroxyapatite. There's so much data out there support either camp, yes or no. So for me, it's like, use it, see how it worked for you, and I'm tracking it. And all about is also consistency and necessity, right? Xylitol is working for some people, and in some people, it's also destroyed their microbiome. And so for me, the xylitol had to be also more like a seasonal. It's not something you just popping, chewing xylitol gum and not brushing your teeth. That's not going to work for anti-cavities.
Gotcha. What's the most overhyped current dental trend going on?
Oh my God, there's so many of them right now. I think the overhype, the fire around, so I'm going to pick. There's so many of them. Right now, definitely to me, toothpaste. Such an oversaturated market. People are so confused. Every day people bringing in from a $20 toothpaste to $100 toothpaste to the tooth putty to the tooth powder. And people are like, which one's better, powder or putty? I'm like, toothbrush. Go back to your toothbrush and enjoy, doing. And I challenge my patient to make their own toothpaste.
Gotcha. No, that's you gave a good recipe too, so that's pretty awesome. So wellness dentistry. I mean, all right, you're in Houston, so I can find you here. But if people want to learn about wellness dentistry specifically, where can they go find a wellness dentist in their area?
Yes, so we do have training program to train these dentists. So organization that nonprofit that been around for over 40 years, like the IABDM, International Academy of Biological Dentistry and Medicine. I'm actually the current president of the organizations. I'm very grateful for their teaching and their mentoring. And then the Wellness Dentist Institute is where we helping these dentists to implement these wellness practices in not just their practice and for the patient, but in their own personal life, because you don't want your provider to tell you all these things and not practicing it, right? You want these practitioners to also take care of themselves, show up as a leader in the practice and as a provider for the patient and telling them, hey, I'm tipping my mouth at night and I feel amazing. Hey, I did sleep study. I do saliva test on myself and this is what I found. So we walk the talk. I think we need more accountability from provider these days than just telling and lecturing patient. We need to live that life and let them know that it works. What doesn't work for you? What worked for you? And patient actually knowing that, that's your authentic self and they follow. And I think people know information out there, listen to your podcast or go online. But if they have a provider that they connect with and they've seen that provider walking the talk and living the wellness life, it's not only an inspiration, but it's like that transformational for them.
Very good. So people want to learn more about you and your practice. Where do they find that information out?
Yes, social Dr. Katie Toe, very straightforward and easy. And our practice name is Katie Toe Center, also on social, Katie Toe Center and Dr. Katie Toe. So follow us, engaging. We have a lot of content and we love podcasts like the Trusted Pharmacist. And so we love sending our patients to listen to your podcast all the time.
That's awesome. And I will say one thing we didn't even get into today is, but I think people can see your passion. They see your love for what you do. They need to go find out about your story. You recently did a TED Talk. I see that you did about your story, and that was very inspirational. So if you love what you heard today, you need to go check out her social media and see and listen to her story because it's inspirational and you'll find out where she's at today because of what she's learned herself. And those tend to be the best practitioners. And so that's really pretty cool.
Thank you, Steve. I cry on stage. Did not plan, but it's just emotional. But it's really emotional relieving how I was a patient, started out as a patient of this journey for myself, seeing what I can do for my patient and now helping other dentists doing that for their patients. So
Very cool. Well, like you said, if you only thought like oral health was cosmetic, I mean, I think you've learned today that you can't separate your mouth from the rest of your body. And you know that mouth plays a powerful role in inflammation and hormones and sleep and breathing. And I will say if this episode, changed how you think about oral health, please share it with someone because I think like, Katie, that we see so many people with mouth issues and it's the big driver of health. And like you said, I just really want to thank you for being here today.
thank you, Steve. Great talk today.
Awesome. You have a wonderful day. Thanks so much.